Welcome back to Steele and Vance. And Linda, we got a number of things we want to cover off in this next segment, but we're going to do a little bit of a flashback look forward off the top.
Well, because there's been a lot of discussion lately about private medicine, two-tiered medicine. A lot of people saying, what about universal health care? This was driven by Doug Ford in Ontario, who announced that he was going to allow some private clinics to be able to do some surgeries to reduce the backlog, but it's all being paid for by the public purse.
Right.
So there were the typical people, oh, this is an outrage. And people are saying, well, no, actually, BC has done that. Alberta does it. A bunch of provinces do it. Quebec does it too, I think. So we had asked our Premier David Eby when he was in studio last week, is BC considering going and doing more of what Ontario is doing?
We are not going to go that route of private clinics, because one of the things that I really worry about is you open a private clinic, where are the staff coming from? The issue we're facing is the shortage of people. Yeah, so you pull people from the public system that are working and you put them in the private clinic, and then you have a profit margin as well you're paying for. How are we ahead?
Yeah,
so we're really focusing on getting those people into the system to support our public healthcare system.
It's so complicated, right, Linda? But the backlog is real. Like
there are 660,000 Canadians waiting for surgery right now. That's a lot.
That's a lot of people who might be suffering in significant discomfort. Obviously, emergency surgeries, emergency procedures and whatnot. We have to compliment our healthcare workers who are doing everything they can to urgently help people. We were talking before the show today. I've got a couple of friends who over the last few weeks have needed very urgent care, and our healthcare workers are unbelievable. But all of them are maxed and overworked and strapped. You know, we hear about Port Hardy where there's one ER physician there. One? And what is he, in his 20s? He's like, please, somebody send help. Oh my gosh, will the private healthcare model make that worse?
Or could we get more BC healthcare workers back into the system if they lift the COVID vaccine mandates? And there are 37 rural mayors in BC who are asking the province to do just that. There were, and I didn't know this, but there were 2,500 workers in BC fired because they refused to get the COVID vaccine. And BC is a bit of an outlier in being kind of, I think, the last province to say, we're not lifting those mandates.
And it's interesting too, because there are people who are loud about bring these people back. Let's do this. Like, well, let's not worry about the vaccine mandate in healthcare. And honestly, we had Dr. Bonnie Henry in studio talking about this, and she's like, I'm not changing that. The most vulnerable people access our healthcare system, and I need to know that they are most protected. There are a lot of people that go there that can't have a vaccine. So how about we do clinics where the unvaccinated healthcare workers can work in? And then
they can only work with unvaccinated people.
Or people who have no problem with seeing, because there are a lot of chiropractors and naturopaths and what have you. And there are lots that are just like, I'm not, and I never will, and I won't. And
but I'd like you to wear a badge, because I would like to know that my healthcare professional believes in science. Right? Because, did you see this report that just came out?
Yes.
That showed that the astonishing power of misinformation around COVID, all those little rabbit holes contributed to, what was it?
How many?
2,800 Canadians dying from COVID.
That's not
fake
bluster.
News.
That is not spin. That is clear, direct line from disinformation and anti-science and anti-vaccine rhetoric out of the freedom that killed people. It killed people because people were hesitant because they thought maybe these people have a point. No, science is science. There's no debate in science.
But the problem was that over 2 million Canadians believed the stories that they were reading about the fact that the vaccine led to suspicious, unexplained deaths and all these things. And let's get real. I mean, there were a couple of complications, and we learned along the way, and there were a couple of people who suffered adverse reactions to the vaccines.
Very few.
Billions of people got the vaccine, and there was like a very, very minimal rate. But the problem is 13,000 people, they say, got admitted to hospital because they didn't believe, they were afraid of the vaccine. They got sick to the point where they needed to be intubated and what have you. And that cost all of our taxpayers, all of us, and the healthcare system.
I will tell you this, Dr. Peter Hotez from Texas Children's Hospital, one of the researchers, vaccinologists who
Big deal.
He is part of the creation of one of the Corbevax and gave up the patent for those who say that he's trying to take your money. He gave up all the cash that could come his way. He's going to come on the show in March. He's coming to Vancouver.
We got all the best guests.
I know, we really do. But he tweeted today there's new science in about the new bivalent vaccine, the booster that so many people in BC still have not gotten because they thought, I'm fine. It's more effective than anybody might have ever dreamed. Go get your
I would
booster.
get it in 2 seconds.
I've got
if
it.
I
It's
hadn't
right in-
gotten COVID in December for the first time
You're gonna
ever.
go. You're gonna.
Oh, I'm
you
going.
talked me into the summer one.
Second I can go.
Yeah.
I'm going.
I love that about you, Linda Steele. I love so much about you.
All right. Next on Steele and Vance.
2.
Can I take back that part about
What
loving
the
you?
hell
Because
is wrong with people?
you brought this to the fore. I got to look away. What the hell?
This is nuts. This is a new sport. I'm doing air quotes. More on the Power Slap League when we come back.
No.